Welcome friends to Broken Narratives. I am your host Jay Firangi coming to you from the Still City, Hamilton, Ontario. As I mentioned in the last episode, today I will cover how COVID-19 deaths were counted and why they were not accurate or reliable number. I will cover overcounting of deaths from COVID-19 and examples of mischaracterization of deaths from COVID-19. Finally, I will also cover how countries were using a new ICD code, International Classification of Diseases code for COVID-19, to be included on death certificates, and what was the criteria they were using to put this new ICD code on death certificates. So this is going to be a short episode. The first clip I have is from C-SPAN, and this is from White House, where you will hear Dr. Deborah Birx, who was on coronavirus task force, coronavirus response team, and she will explain how US was counting COVID-19 deaths differently from some other countries, and what was wrong with that.
There are other countries that if you had a pre-existing condition, and let's say the virus caused you to go to the ICU and then have a heart or kidney problem, some countries are recording that as a heart issue or a kidney issue and not a COVID-19 death. Right now, we're still recording it, and the great thing about having forms that come in and a form that has the ability to mark it as COVID-19 infection, the intent is right now that if someone dies with COVID-19, we are counting that.
So this was very early in the pandemic in April 2020, and as you heard towards the end that US was counting people who were testing positive for COVID-19 as a COVID-19 death. But it doesn't mean that the people died from COVID-19. There is a difference between dying from COVID-19 and dying with COVID-19. And in this second clip from CNN, you will hear more details on that. You will hear Dr. Lena Van describe in details why all those things matter, that we figure out who are the people who are dying directly from COVID-19 and people who have other conditions, major underlying health conditions, but COVID was a contributing factor, and some more details on COVID-19 death count.
I talked to a lot of health officials about this who are actually kind of skeptical of this claim that you're making. And I think one big thing has been, what is the evidence that these COVID deaths are actually being overcounted?
There is a way for us to look at death certificates and also to look at the medical records of individuals prior to their death. And I think this needs to be separated into three categories. One is the COVID as a direct contributor, the primary cause of death. The second is, could it be a secondary contributing cause? So, for example, somebody with kidney disease, COVID then pushes them over the edge to have kidney failure. That's COVID as a contributing cause. And then the third is COVID as an incidental finding. So somebody coming in with a gunshot wound or a heart attack and they happen to test positive. I think that we need to separate out and look at the percentages of each. That percentage would have shifted over time as well. In the beginning, probably a lot more people were dying with the primary cause of COVID. That probably has shifted.
And not only that people were mischaracterized dying from COVID-19 or with COVID-19, and COVID-19 was mentioned as a cause of death on their certificate, but doctors were pushed to mention COVID-19 as a cause of death on death certificates. And here I have an example from an ER doctor. He's from California, I think, Dr. Erickson, and he's going to explain how other underlying health conditions were ignored, and his colleagues around the country were pushed to mention COVID-19 as a cause of death on death certificates.
This country right now, they're not talking about the high blood pressure, the diabetes, the stroke. They say, did they die from COVID? We've been to hundreds of autopsies. You don't talk about one thing. You talk about comorbidities. Their vessels were narrowed. Their lungs were a smoker. COVID was part of it. It is not the reason they died, folks. It is one of many reasons. So to be so simplistic to say that's a COVID death because they have COVID, you know how many people die with pneumonia or people that die from flu? With flu, I should say. It's not from flu. Their lungs were compromised by COPD. They had a heart attack 2 years ago. They have a weakened body. We aren't pressured to test for flu. But ER doctors now, my friends that I talk to say, it's interesting. When I'm writing up my death report, I'm being pressured to add COVID. Why is that? Why are we being pressured to add COVID to maybe increase the numbers and make it look a little bit worse than it is? I think so. So this is what I'm hearing from physicians I talk to in Wisconsin, New York, and everywhere.
And here is another example of similar things mentioned by a physician and politician, Dr. Scott Jensen, who is an American physician who is also a member of Republican Party, who was a member of Republican Party in Minnesota Senate, and he was in Minnesota Senate from 2017 to 2021. And when he had given a long interview to Dr. Jordan Peterson, he also mentioned so many details regarding how things were handled during the COVID-19 pandemic. And in this short clip, you will hear him express similar concerns that how doctors were pressured to mention COVID-19 on death certificate as a cause of death.
I received an email from the Department of Health with a link to the CDC advising me as a physician that they were going to adjust the way death certificates were completed.
What did adjust death certificates mean?
They said in this document, if you think that COVID-19 was a contributing condition, you can put it down as a cause of death. And I said, no, there's a box 2 on a death certificate called contributing conditions. That's where you put contributing conditions. If it's emphysema, if it's asthma, influenza, we put it in the contributing conditions box. We were being told with this disease, we could put it as a cause of death.
So, and this next clip is from August 2020 of Dr. John Ioannidis. I had played clip from him when I had covered COVID infection fatality rate, and he was also a practicing physician. And what was his experience when writing death certificates, and how what's his opinion when counting COVID-19 deaths? What should be kept in mind that how deaths were counted, and what's the problem with putting causes of deaths on death certificates? Like there are issues. It is not so easy, according to him, to figure out the exact cause of death.
Anyone who has tried to fill out a death certificate, here I'm coming back to the years when I was a physician, and I had to write death certificates. It's very difficult. It's very difficult not to make mistakes in death certificates. We have multiple studies preceding, of course, the COVID-19 era. Death certificate error rates can be from 50% to 90%. It's a notifiable disease. You need to note it no matter what. I think we need to wait for the dust to settle to know how many of these deaths were from COVID-19, how many were with COVID-19, how many were induced by the crisis. The fact that we had the pandemic, the fact that we had the lockdown, we know that there's several reasons why you may get excess deaths. I mean, people with heart attacks do not go to the hospitals. Heart attack is the key reason that one can die, and hospitals can really take care of that and reduce mortality substantially.
Yes, so these kind of concerns were brought forward by many physicians, but they were ignored, as was done for many other issues during the COVID-19 pandemic. And the next two clips I have are from the Dalvik tree show the high wire, and these two clips will go in details how COVID-19 was put on death certificates, and how CDC guidelines changed during COVID-19 pandemic to use this ICD code that I mentioned at the beginning, how to use that code. This next two clips will give you details, and this will make sure that you get better understanding that why COVID-19 deaths were overcounted based on the criteria they were using.
This is the guidance for certifying COVID-19 deaths. And what it goes on to say, it is important to emphasize that coronavirus disease 2019 or COVID-19 should be reported on the death certificate for all decedents where the disease caused or is assumed to have caused or contributed to the death. Now, it goes even deeper because we didn't really look closely at the death certificate itself. Here's how it tells you to fill it out. Can we bring up the death certificate? If the decedent had other chronic conditions, such as COPD or asthma, that may have also contributed, these conditions can be reported in Part 2. So this patient, I'm imagining is an imaginary patient, had an acute respiratory distress syndrome for the last 2 days, so obviously they were going into a major problem. They also had pneumonia for 10 days, and they were diagnosed with having had COVID-19 or assumed to have had COVID-19, which is what they tell you, right? So put that in the top group, and what you're going to list this as is a COVID-19 death. Now, if they were suffering from something else like a heart disease or COPD, which they told you with an acute respiratory illness, put that in Part 2. Part 2, the less significant part of this document.
And let's hear some more details from this second clip.
But they actually came out with an exact coding now, saying we have a code for COVID-19. This is the article. The new ICD code introduced for COVID-19. This was March 24th. What happens, all right, and here's what it goes on to say. For those questioning, how do you use this new code, right? What happens if the terms reported on death certificate indicate uncertainty? If we have a question, look what it says. If the death certificate reports terms such as probable COVID-19 or likely COVID-19, these terms would be assigned the new ICD-9 code, meaning it doesn't matter if you were guessing at it. Doesn't matter if you just thought maybe it was COVID-19. Put in the ICD-9 code. And in case you're worried about backlash, look at this sentence. It is not likely that NCHS will follow up on these cases. If you think that that's not enough, they double down on this. When you look at this entire letter, there are literally only 2 sentences that have been bolded in the entire letter. The top, new ICD-9 code introduced for COVID-19 deaths. Go all the way down, and there at the bottom, we want you to know, assumed to have caused or contributed to death. Use the code even if you're just assuming it's a COVID-19 death.
So this was direct guidelines from CDC to how to mention COVID-19 and how to use new ICD code, which was given from CDC to be used on death certificates. And as you heard, and that even if they assume that a person has died from COVID-19 or likely that person had died from COVID-19, not even having a positive PCR test, which was in a problem in itself. But if they assume that person had died from COVID-19, they were supposed to put COVID-19 on death certificate. Now I just want to go through few articles and give you some more details on some mischaracterizations, examples of mischaracterization of deaths, and overcounting of deaths in different states and counties in US. And this first one is from CTV News in Canada. Why the exact death toll from COVID-19 may never be known. And this was published in April 2020, and here they have mentioned the World Health Body has recently released a new ICD, International Classification of Diseases code for COVID-19, to be included on death certificates in order to capture mortality data for the disease. Dr. Prabhat Jha, the director for the Center for Global Health Research at St. Michael's Hospital in Toronto, explained that new code is supposed to be applied to cases in which the patient tested positive for COVID-19, the patient had a probable cause of COVID-19, but lab results are still pending, or if the patient tested positive for COVID-19, but there is another cause of death. So in all three situations, they were supposed to use ICD code for COVID-19 on their death certificate. Tracking mortality rates for the disease becomes substantially trickier, however, when people suspected of having COVID-19 die before they are tested. So this was another reason, like many people were dying at home because they were afraid of catching the COVID-19, so they were not going to hospital. People with heart conditions and strokes, as I had covered previously during the lockdown episode, that many people were dying at home. And here they are like those people were never tested and they might have had COVID-19. So even there they are saying that COVID-19 deaths were undercounted because many people were dying at home. Now let's see some example of mischaracterization or overcounting of deaths. Here is from Fox News from May 2020. Colorado amends coronavirus death count, says fewer have died of COVID-19 than previously reported. The change came after Colorado's Department of Public Health admitted that its COVID-19 death toll was counting those who tested positive for the coronavirus but had died of other causes, Fox 31 Denver reported late Friday. The department now says 1,150 Coloradans who died had COVID-19, but only 878 of those deaths were due to COVID-19. Here is from the Daily Mail. Thousands of coronavirus deaths will be wiped off the government's official toll after urgent review into counting fiasco that included people who had recovered and died of other causes in the toll. Academics found Public Health England's methods meant ministers count victims as anyone who died after ever testing positive for COVID-19, even if they were hit by a bus after beating the disease months later. Professor Hannigan, director of the Center for Evidence-Based Medicine at the prestigious university, told The Sun, "It is a sensible decision. There is no point attributing deaths to COVID 20 days after infection." Here is from Scientific American. Debunking the false claim that COVID-19 deaths count are inflated. President Trump and other conspiracy fanaticists touted the fake claim that COVID-19 death counts are exaggerated, but three kind of evidence point to more than 350,000 deaths. So here they are trying to debunk the claim, but as you will see that what they have mentioned, it proves that they haven't debunked anything. Twitter removed the post for containing false information, but fabrications such as these continue to spread. So they are mentioning regarding some tweet that some person had made regarding this. This number is supported by 3 lines of evidence, including death certificates. And as I just covered, that death certificate, they were using new ICD code and they were putting COVID-19 for everyone who died directly from COVID-19, or COVID-19 was underlying condition, or COVID-19 was even just assumed to be there when patient died. The second line of evidence comes from the National Vital Statistics System, which records birth and death certificates. So again, death certificates, but as you know now that how death certificates were made when COVID-19 was either cause of the death or underlying condition of the death. A physician, medical examiner, or coroner fills out the cause of mortality on the death certificate. That specialist is instructed to include only conditions that caused or contributed to death, Anderson says, which is false, as you heard from those last two clips. Even if they had assumed or likely that person had COVID-19, they were using ICD code for COVID-19 deaths. Grant County coroner raises concern over deaths among COVID-19 cases. The Grant County coroner is calling attention to the way the state health department is classifying some deaths. The coroner, Brenda Bock, says 2 of their 5 deaths related to COVID-19 were people who died of gunshot wounds. And Bock says because they tested positive for COVID-19 within the past 30 days, they were classified as deaths among cases. The state health department says the Centers for Disease Control and Prevention requires them to report people who have died with COVID-19 in their system because it's crucial for public health surveillance. So similar story. And California County cuts death toll after finding fatalities clearly not caused by COVID-19. Published in June 2021. The coronavirus death toll in California County has been cut by 25% after officials found that some fatalities were not a direct result of the virus. Alameda County previously included any person who died while infected with the virus in the total COVID-19 deaths for the county, health officials said in the statement. So they were doing this all throughout 2020 and 2021, but here in June 2021, they acknowledged that they were mischaracterizing deaths. Here is an example from Canada, CBC News. Hinshaw apologizes to family of 14-year-old after saying he died from COVID-19. So this young child, 14-year-old boy who had died from cancer, but Dr. Hinshaw said on the press conference, during the press conference, that he had died from COVID-19 and she had to apologize for that. Here is an article from Association of American Physicians and Surgeons. Biden's bounty on your life. Hospitals incentive payments for COVID-19. And here they mention how hospitals and doctors were incentivized by governments to put COVID-19 on their death certificates and much more. A combination that enables this tragic and avoidable loss of hundreds of thousands of lives includes 1. The CARES Act, which provides hospitals with bonus incentive payments for all things related to COVID-19, testing, diagnosing, admitting to hospital, use of remdesivir. In some reason I am not able to pronounce that name, and ventilators, reporting COVID-19 deaths and vaccinations. And second, waivers of customary and long-standing patient rights by the Centers of Medicare and Medicaid Services. The hospital payments includes, and I'm just reading last 2 points, more money to the hospital if cause of death is listed as COVID-19, even if patient did not die directly of COVID-19. A COVID-19 diagnosis also provided extra payment to coroners. So if the hospitals mention COVID-19 on death certificate, they would get more money from the federal government. Here is from the New York Times that I have covered in the PCR test episode. The same article, your coronavirus test is positive, maybe it shouldn't be. So most of the numbers, as I have mentioned earlier, that cases, hospitalization and deaths count were all based on using PCR test. And as I have covered, that PCR test is not a diagnostic test, and it depends on many things, a number of cycles they were using, and when it was patients can test positive for a long period of time. And as you can see here, it says with cutoff of 35, about 43% of those tests would no longer qualify as positive. About 63% would no longer be judged positive if the cycle were limited to 30. In Massachusetts, from 85 to 90% of people who tested positive in July with a cycle threshold of 40 would have been deemed negative if the threshold were 30 cycles, Dr. Meena said. So if all these numbers, death counts, were also based on PCR test, then many, like 50% or more of these numbers were false, because they cannot culture a virus after certain cycle threshold, as it's mentioned in this article. Manitoba chief microbiologist and laboratory specialist, 56% of positive cases are not infectious. So as it says in this article, that a study from Dr. Bullard and his colleagues found that only 44% of positive PCR test results would actually grow in the lab, meaning 56% if they had a dead fragments of the virus in their system, so they were not infectious, or they were not sick from COVID-19. They just found debris of coronavirus in their blood. So again, two major reasons that death count were based on PCR test, and second, that the new ICD code was introduced for COVID-19, and even if people were assumed or likely had died from COVID-19, COVID-19 was put on their death certificate. So these are two major reasons I believe COVID-19 death count were inflated and not accurate. And it just those death counts were used, daily death counts on your TV screens were just used to frighten people and make them do certain things they wouldn't do in normal times. So this brings me to the end of this episode. I hope you learned something new and would share the same information if you find it interesting with others. And I know it's 2024, most people are not interested. That's why I think most of the feedback that I'm getting from my friends is that, like, why are you covering COVID-19? It's a thing of past and nobody is interested in it. But I think we have so many lessons to learn from this manufactured crisis, and because they will use same tactics in the future as well. So I hope you share this information with your friends, family, and colleagues, and help me reach more people. With that, I would like to thank you for watching Broken Narratives. Check out the show notes. I'm your host, Jay Firangi, coming to you from the Still City, Hamilton, Ontario, and I will see you in the next episode.